Hello, friends. Keep signing in. Had a lot of people sign up for this, so I'm excited about all the people that are going to get this information today. Okay, a few names on here I don't know. Most of them I do. Okay,
Well, good. You can always meet new people.
that's right. Okay, we are waiting on Crystal to get back. She's logged in, but she had to run and go get something. And as soon as she gets back and gets plugged in, we'll officially start this thing. Let's see, Abby. What are you saying, Abby? Laura, did you get a haircut? I did get a haircut. Have I not seen you since I got my haircut? Have I not seen you in person? Maybe not. Oh, thank you. Okay. A few more signing in. Okay, about 27 people so far. 24. Three of them
That's
are
good.
us.
That's good.
All right. Okay. Excellent. Yes. Yes, copy. Were you getting ready to say something?
No, I was just adjusting.
Okay. Yeah, get comfortable.
I'm in a different chair and I feel like I'm at a church pew and I need a booster seat. I moved to a conference room instead of being at my desk so I wouldn't disturb.
An airplane flew over and I didn't hear what you said. Sorry.
Oh, I came to a conference room instead of being at my desk so I wouldn't
Oh,
disturb coworkers.
okay. All right. We have 29 people
Nice.
logged in right now. Excellent. And there's Crystal.
Well, let's see if that works. Okay.
Okay.
Poppy, you try to talk. Okay.
Okay. How's it sound to you? Does it sound okay?
Yeah.
Okay.
Sorry about that, Laura.
Okay.
We're good.
Um, Welcome everybody to a session from our friends at DCBS. Koppy Rhodes and Crystal Wilder have some good information for us today. And so I'm just going to turn it over to them, let them talk about who they are and what they do and how your clients can benefit from that. So just going to turn it over.
Oh, thank you so much. Thanks so much for having us here today. I love, 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 as you all know, this group. I love the work, the group and this community table that we can come together and share these resources. So I say that and say thank you for allowing us to be here today and to share some information that all of the families, many of the families that we work with, um, need to help in accessing resources. And it is a daunting task to access resources, as we so often know. And as I'm learning, as Laura said, I am with DCBS. My name is Crystal Wilder, and I'm a community engagement associate for the cabinet. I'm going to share my screen just to give you some of our basics on what that looks like. Hang on. I'm going to go up really quickly and take it right here. And so, oh, nope, sorry. I'm doing it here. I'm trying to just make it in that we only have those four slides. But I wanted to start off by saying our primary, the Cabinet for Health and Family Services, And I just wanted to share this so everyone can see is that we are responsible for providing resources to families to assist them on focusing on safety, well-being, and permanency for children. I share that to say a lot of people who hear from the Cabinet for Health and Family Services oftentimes don't realize that under that umbrella, people often think one or the other, that it is all protective services, such as child protective services, adult protective services, um, where you become a foster parent. And it's actually a huge umbrella. There are a lot of other places, a lot of other entities as well, but another is our family support. And so I love that that is under that umbrella to really encompass all of that, those resources to the families. Because when we are providing resources to families, that's what we're doing. We're focusing on that safety, that well-being, and that permanency for children. The Cabinet's mission statement is to be a diverse and inclusive organization providing programs, services, supports that protect and promote the health and well-being of all Kentuckians and their communities. I read that verbatim purposefully because I love it, I live it, and I never want to mess up any of those words because I love that that's where we are and that that's the cabinet and that that's our mission statement, that that's what we want to do and to provide those services and that support that is so very vital to the well-being of all Kentuckians and all communities. And our vision, of course, is a Commonwealth where every Kentuckian reaches their full human potential and all communities thrive. And so with that, under those pillars and our values are equity, health and well-being, structural economic support, resilient individuals and communities, and operational success. So today, I really appreciate the opportunity to talk some about all of this, but specifically, I'm going to focus on today that operational success because well, I could share a lot, and anyone on here who knows me knows I can talk a lot and I can share a lot. But I think it's really important to have our experts on, and Koppy Rhodes is one of our experts. She is one of our specialists within family support, and she will talk more about her role and introduce herself. But I just wanted to let you all know why and what we have. And um, I'll provide these very quick slides to Laura as well, only because then we have our reference that we know and we have that reference page and that it is a hyperlink directly to everything that Koppy is going to talk about. When she's talking about and walking through a form and the application process, I'm going to drop that in the chat. I'm also watching the chat. We'll wait for the end to ask any questions or to answer any questions, but I promise there will be that time for questions and to see that. And so just wanted to let you all know that and that you'll have that. And as we go through this process, and I'm going to go ahead and drop um, the application in the chat so that you can reference that as Koppy is going through that. And thank you so much, not only for being here today, but for the work that I know each of you are doing for the families that we serve and to help make our community a stronger place and a better, safer place for all individuals. Thank you so much. So without further ado, Ms. Koppy Rhodes.
Thank you so much, Crystal. I appreciate that. Oh, very well stated. Um, good afternoon, everyone. As you know, my name is Koppy Rhodes, and I thank you for the invitation to speak today. Um, I serve as one of two SNAP program specialists, otherwise known as PAPS, for the cabinet. I've been with the cabinet for since 2000. So I'm very proud of my job and proud of what I do and the community that I serve. Um, my goal today is to help explain the various ways individuals can apply for SNAP benefits and to collaborate how we can work together to reduce the barriers for our at-risk homeless population. So there are several ways to apply for SNAP benefits. Um, in person, you can apply at any local DCBS office. There is also interpreter services available. There's 7 DCBS offices in Jefferson County. They're open Monday through Friday from 8 a.m. to 4:30 p.m. The locations are in different areas and zip codes to help with the accessibility. The L&N building being kind of the main office, but then we have different neighborhood sites. There's Northwest Neighborhood Place, Ujima Neighborhood Place, Cane Run Neighborhood Place, Fairdale Neighborhood Place, First Neighborhood Place, and also South Central Neighborhood Place. You can also apply by phone. The toll-free number, 855-306-8959. Also, interpreter services are available. The phone lines are open Monday through Friday from 8 to 4:30, and also on Saturdays from 9 a.m. to 2 p.m. One of the most popular ways to apply is through a paper application that's called a FS1. And you can access this application at any local DCBS office. You can also get it on the website, connect.ky.gov. It's KYNECT. Or you can request it by mail. You call on the phone and ask one to be mailed out to the address. With the hard copy application, this does require an interview. So it can be either in person or by phone. To be an accepted application, it must have the name, address, and your signature. Adding a contact number is not required, but it's very, very important. So it can speed up the application process for the required interview. Otherwise, the worker will have to put it on the system, and then a request for information will be sent to the address listed, letting them know that they need to complete an interview. So it's important to have a contact number to speed up the access to access benefits. Once the FS1 application is completed, you can return it at any of the local DCBS offices. You can also mail it back, and you can fax it. So in the mail and the fax are with Frankfurt. That is where all our mail and our faxes go to, and they're scanned into the actual case record. We also have a online self-service portal, and this is at the same online address, the kynect.ky.gov connect. This is where individuals can set up an account for themselves. They can go on to the website and they can apply. They can complete the ongoing SNAP recertifications. They can upload any documents on the portal. They can report changes. They can also review their case status. An important thing too is also having the access to the self-service portal account. They can choose to receive notices or correspondence per email. So if they don't have a stable address, the important notices that are sent out by the cabinet for reminders can be uploaded into that self-service portal. That way they won't miss any notifications. Also, if an individual applies through the self-service portal, it'll be a pending application, and this also requires an interview. So that can be by telephone or in person. A really good way that helps individuals apply is to have an authorized representative. And this is an individual that the client can appoint to authorize and appoint to be an authorized representative to act on their behalf. So they can speak for the client and they can apply or recertify, report changes. To be an authorized representative, it has to be someone who's 18 or older and knows the client situation. It cannot be an employee with DCBS um, or an EPT card, which is the SNAP card retailer. Um, the individual can provide a written statement to designate an authorized representative, or during an application, while the client is being interviewed, the client can request to add an authorized representative to their case. And once they sign the application for those benefits, that is the written designation for that representative. The FS paper application has a section where the authorized representative can be designated to. So if they use that application source, they can write in who they would like also. So when an individual applies, they may be eligible to receive what we call XSNAP or expedited benefits. These are benefits that an individual can receive within 5 days. And there's certain requirements to be able to be eligible to be expedited. Um, Definitely, we have to have an ID, a signed application, and an interview completed. Those are the three things um, that have to have in order to have that expedited. Um, Requirements would be income of 150 or less, liquid resources of $100 or less, and if they have any expenses, the combined gross income and liquid resources are less than any of the shelter expenses. So if they qualify for expedited benefits, they can receive those within 5 days. Now, granted, they still have to, if they don't already have an EBT card where the benefits are placed, they would have to wait for the card to come in the mail, but they would still receive the benefits quicker than waiting for an application that can take up to 30 days. Expedited benefits can be approved for 1 or 2 months. It depends on when they apply. If an individual applies before the 15th of the month, then they'll receive the expedited benefits for that current month. If they apply the 16th or till the end of the month, they'll receive the expedited benefits for the current month and the month after. And any individual who's approved for expedited benefits will have to complete a second interview before the end of the month. If it's the first month or if they get them for 2 months, that second month, they have to complete that second interview, and that will be for the ongoing benefits. For the second interview, they will have to verify certain mandatory verifications, which is, for example, who all lives in the household, no income or income reported, and if they claim to have any kind of incapacity or disability. Expenses and deductions are optional verification. They're not required to process any application. After each application, the worker will explain what is needed to process the case to receive the benefits. A request for information notice will be given if it's face-to-face or mailed out if it's a phone interview with the same information. This request for information will state the date that the verifications are due. Also, it sent out or given to the individual or DCBS forms, which can assist with these verifications, such as I mentioned, who all lives in the household, a form to be used to verify income or no income, or a form to verify any type of incapacity or disability. These forms are not required to be used. They're just given or sent out to assist with access with being able to get these verifications. Individuals have 30 days to provide the requested verifications. So once these have been received, the case will be processed, and a notice will be sent to inform the client of approval or denial of the SNAP benefits. If the benefits are approved, the notice will include the amount that they're eligible to receive and also the months that they receive. So it's called a certification, the time frame that they will be receiving these benefits. If the SNAP application is denied, the notice reason will state the reason for the denial of the benefits. If the mandatory verifications, such as household income, no income, incapacity, are not received within the 30-day time frame, the application will be denied and the individual will have to reapply. So it kind of means they will have to start over with that application. For a renewal, which is ongoing benefits, once they already established and have an active case receiving SNAP benefits, the individuals will be notified a month in advance when it's coming time due for that renewal. So a notice will be sent out through the correspondence, either to the mailing address that the individual has stated, or if they have that self-service portal and they choose their correspondence through email, will be sent to that email, letting them know when they can come in, the beginning date to begin that renewal, and when the renewal has to be completed by. If the renewal is not completed within 30 days of that first notice, a second reminder notice will be sent out with the same information, letting them know and that when the end date is due, just to help the individual. For renewals, if the individual fails to complete that renewal, once again, they will have to reapply and start the process over. So it's important, again, to have access for this correspondence, whether it be a valid mailing address or a valid email address if they have that self-service portal, because the correspondence is very important to know any type of upcoming appointments or any changes. Once the SNAP application is approved, if it's new and the individual does not have an EBT card, which is an electronic benefits transfer, that is a card that the SNAP benefits are placed on every month in order to shop to receive the food benefits. So once the application is approved, the EBT card is mailed to the reported mailing address. Once again, I keep hitting on that address. It's very important to have a mailing address to where the client, the individual, can access notices, benefits, this EBT card, because otherwise they won't be able to access their benefits. If the individual does not have a stable mailing address or someone they can use as a mailing address, they can request the EBT card be sent to the L&N building. That's the only location, DBC office, DCBS office, that can have the EBT card requested to be mailed to be picked up. So once the card is received at the L&N building, the client will be notified that the card is available to be picked up. So it's another important way to reach out to the clients is through a valid working phone number. So this is another way an authorized representative can really assist. If the client does not have a valid phone number or a stable phone number for contact, if they have an authorized representative that can be contacted to let them know that this card is ready to be picked up. That way they can access their benefits quicker. An ID is required to pick up the card to verify the identification. The card is not active when it's received, there's activation that's required. The card has American flag on it. And on the back of the card, there's a toll-free number that you will call to activate that card. And what it requires is the 16 digits and also your date of birth. It's all automated that you put that information in to verify it's you to get that activated. Also, the individual will need to choose a 4-digit PIN number for access. It's extremely important that they do not share this PIN number with anyone or write it on the card itself, because if the card is lost or stolen, the benefits cannot be accessed unless that PIN number is known. If an individual is having trouble and can't activate their card, they can always go to a local office or call into the toll-free number and speak to a worker, and workers can assist with getting that card activated for them. Also, calling the number on the back of the EBT card, you can check your benefit balance at any time. If the card is lost or stolen, you can call that number. If you do know it on the back of the card that it's lost, but if you do have that number, you can call to report that to order a card, or you can stop in any DCBS office or call the toll-free line to report the card's been lost or stolen so a new card can be ordered. Monthly SNAP benefits are deposited on the EBT card the calendar day after the last digit of the individual's Social Security number. So say the last digit is a 9. That would mean that the benefits are placed on the EBT card on the 10th day of each month. The only exception is if the individual was approved for expedited benefits. If they received expedited benefits, the benefits will be on the card when it's received. Our homeless population is particularly vulnerable and has several reoccurring issues that can interrupt and prevent their access to the SNAP benefits. Some of the most common are missed renewal appointments. So, as we know, many individuals lack consistent access to transportation, calendars, reminders, which makes it difficult to keep scheduled interviews or recertifications. Unstable or unreliable mailing address. Notices may be sent to shelters, temporary residents, outdated addresses, and this will result in missed deadlines or lost communication. A big one is phone numbers that are no longer active. Limited access to stable phone service means workers often cannot reach the clients to complete interviews or request additional information. Mandatory verifications are not returned. Without secure place to store documents, reliable access to printers, emails, transportation, clients can struggle to gather and submit their requested verifications or even timely. So a really big one that we see is the verification submitted. They're submitted, but they're not valid or acceptable. So when documents are incomplete, unclear, they don't have the correct information, staff may be unable to reach the client to resolve this issue. Because that's one of the first thing that a worker is going to want to do when they received a verification that may not have what is needed. They're going to pick up the phone to try to reach out and get this information in order to process the case. Instead of just sending a request for information, you want to try to get as soon as possible by phone. So if they don't have a reliable contact method or that fixed address, if they have to send out the request for information, this causes the case to discontinue. That's another way I think that having an authorized representative can really assist with helping certain individuals to make sure that they receive all the information that is requested. If there's any kind of report changes to their case, any more information needed, someone can be contacted so the individual knows and there's no discontinuance of the cases or benefits not being processed. So now we have time for any questions.
Copy, thank you so much. And I wanted to share, I have been trying, as you all may know, and I have sent to Laura that family support worksheet, that tip sheet. As you notice, um, there is limited information that this is different for me. And I realize that this may be different for you all in some of your agencies as well, that can be shared on receiving those SNAP benefits. Because when Coffee and I sat down and talked about this, full disclosure, I said, okay, can you give me this and this and this, and we can share out, and that's really difficult. And that's something that's a bit different for us. But I will say the reason for that full transparency is it is an ever changing. Yes, that sheet will be available, and I have actually tried to download it in the chat. It looks like about 5 times, and it says that it is not downloading for whatever reason, but I will be certain to email that out to Laura. We also have that in a Spanish version through the portal, as Copy had shared. We can download any version, I think, for that. But then we can also use interpreter services. I always encourage people to come in and work directly with a staff member. I just think that it can be much easier. We can answer any of those questions. We will always include interpreter and provide interpreter services. So I just wanted to share and to go back to why we can share this information now. When you receive this, you will always notice on almost anything from DCBS or from any agency, a revision date. This was last revised, I think, October of 25. If it is anything prior to that date, please discard it. And I cannot stress that enough. That's why I think it's frustrating sometimes when I'm on a webinar or when I am at an event and someone says, "Oh, just look at our website, just look at our website." And I think to myself, and I've shared this with other people. If I just wanted to look on your website, I wouldn't have come to a webinar, or I wouldn't have been reaching out for assistance. But in terms particularly of SNAP benefits, in the current climate that is ever changing, and we all know what we faced, the crisis that we faced in the fall, it was ever changing. And by ever changing, I mean truly not even day to day, the information that we received, it would be at times hour to hour, the information that we received. And that's why the cabinet is hesitant about providing and like flooding with that information, because we always want to ensure that that most recent revision is the one that is being provided. So
Yeah.
at the L&M building, you can always come in and see, and that comes in, and those that last revision of that. But yes, that will be shared, and I apologize that I'm not able to drop it in the chat for whatever reason. It says network disconnected. So I apologize for that. I will send that to Laura, and I am confident that she will, and we'll send that to the group. If there are other specific questions, if anyone wants to drop them in the chat,
There are a
we are
couple in the
happy.
chat.
Okay, perfect. We're
Abby,
happy to answer those.
yeah.
Here's what I will say is that um, we can never offer case specific answers, but I know I see one chat, and so Copy, I'm going to have you respond about, and I think you talked to us about the authorized reps that can be legally responsible for a client's actions.
Mhm.
Is that true? And if so, how should case managers, such as working with an unhoused population, if someone is coming in and working and they are a case manager and they are the person who is filling this out and they are the person who is filling it out for them, can they be legally responsible? Um, and how should case managers navigate this?
That is correct. If an individual does agree to be the authorized representative, they are speaking for the client, so they are responsible for the client. Um, In any document, though, say not even the authorized representative, say if a friend or neighbor fills out a document from DCBS to verify who lives in the home or that the individual has no income, they're signing that, this is true and valid, any information.
So what I'm gonna add to that caveat, because I don't want that to be a deterrent for our case managers on here today. I don't want that to be a deterrent. What I do want to ensure that we know is that everything is dated. That goes back to that time and date stamp, everything. Because what you will swear to is that on the date that your signature and on the date that that was filled out, all of that information was true to the best of your knowledge and or abilities on that
Right.
day. And that then alleviates. And so that's where a lot of that, we talk about this a lot. We talk about this in a lot of different settings where that documentation is key. And Copy talked about addresses and phone numbers, and to say, this is the last known phone number that I had for this individual, or this is the last time I had interactions with this individual, because then I hope that that kind of alleviates some of that worry for our case managers and being that deterrent. But I think that that's how we would navigate this. And Laura, please correct me if you feel differently, or would suggest anything different in that at all. I always just think that strong documentation, um, that then that alleviates some of that confusion and liability. Um, will a person make this call to say a client's card is ready and they're automated and don't have information who the call is for? So, Copy, can you talk to us about that one? Well,
Well,
if
if
the
the client requests the car to be sent to the L&M building because they don't have a stable address, is that what the question is?
no, and Christian, I would say, correct us if we're wrong. When I read that as a case manager, I interpret that as a case manager working with the individual, not a case manager with family support. Is that correct? So let's talk in terms, okay, specifically if they're calling about a card. So not, so a case manager, not their family support case manager, because I know that that's also confusing as we intertwine those words on a very regular, and that title on a very regular basis.
Christian, sorry, so that she can clarify the question.
Yeah, and I think she did in in the chat that specifically if they're calling about a card. So if a case manager copy is calling about someone else's card, what is required if they are calling about the card and they don't have the specific card information, but they have the individual's information? What are some questions that may be asked? So
So, if I understand, you're saying if the case manager is calling to ask about the EBT card, like, is it on its way? Has it been coming? Well, first of all, the case information of an individual can't be given out unless the individual is listed as an authorized representative to to be able for this information to be given out.
Okay, so does that help with that one? So in order to receive that information, if the person is not in your office with you, unless you are that authorized rep, you will not be able to receive that information on behalf of someone unless they are there with you or you are their authorized rep.
Correct.
And so,
Sorry, I
oh,
unmuted because I was trying to clarify. I'm a case manager, and there are times when clients do use me as an authorized representative because of their situations. However, I'm asking if a client does mail a card specifically to LNN, will a person, not an automated call me to say it's available?
Oh, yes, as I was stating, that's why it's really good to have a phone number, a valid phone number, because when the card comes to the L&N building, the worker will call to let them know that the card is here to come pick up, and they will need to bring their ID. Yes, they will receive a phone call.
And that way
Okay.
you will know
I was,
exactly who they, which card they are calling on behalf, which individual they are calling on behalf, because my guess is you may have more
Misunderstood.
than one person who that may be the situation. Is that correct?
yes, many clients have used my phone
Yes.
number
Uh,
when they're calling and getting SNAP benefits. Uh,
yes.
and then I'll get automated calls and they'll be like, your SNAP is coming up for review, but there's absolutely no information about who it is. There's no name, there's no anything. It's just an automated call that says someone in your family, and then I have no clue who I need to be supporting.
So
Okay,
that's different
makes
than,
sense.
and that's different than the renewal. That's different than
Yeah.
a card coming into the L&M building. The renewal is automated, is my understanding. Is that correct, Copy? And so I don't know that that could be changed unless at the time of the application process, there's a note on that to say, please specify. And in all fairness, I don't know that that would even be possible. Copy, do you know if that's possible?
I and honestly do not know if that's possible, but they will also receive notices, correspondence for mail, if they have it being sent to an address, or if they want their correspondence to be to an email. They're also going to receive notices about the recertification that way.
Okay. So that so whatever address they may be using, but twofold. And I do understand how that could be a frustration because you are just receiving that automated call that says that it is ready.
As far as the EBT card, when they come to the L&M building, there's a certain supervisor who receives these cards. That's who makes the calls out and puts in the system the card's been received, and then the individual has 30 days. They'll be contacted to let them know that the card, but in person, nothing automated. If it's an authorized representative that they are contacting, they're going to state, I'm calling on behalf of such and such to let them know their EBT card has been received at L&N building. Please come with a valid ID so the card can be picked up.
Perfect. So there is another question, and I hope that answered that question in terms of if a new card comes in, but then the renewal process, it may still look a bit different. We can always ask, but I saw another question that it is, and I anticipated that we would receive questions about exemptions and that it is now required for people to work or volunteer to get benefits. And so can you speak to us? And this is another part that where we are authorized to answer and not answer on something like this that is recorded, because if it's recorded and watched, I don't know, even a month from now, that may be different. And so that's why we are hesitant to say. We can tell you right now today on April 1st of 2026, beyond that, that's where that information is that ever changing and very fluid with our current environment. But Copy, can you tell us today,
Mhm.
are there exemptions for a person if they are homeless or currently in treatment?
What you're referring to is work registration. All individuals who apply for benefits are required to work register. When they sign the application, they're stating that they're um, will work register. Now, yes, there are exemptions. It says a treatment. Any individual that is in a DAA facility is or is receiving any kind of substance. This is what they go by substance abuse treatment. As long as they provide verifications, they will be exempt to work registration. Um, it also says if they're homeless, as Christy's stating, the policy changes. If an individual is just homeless, that is not an exemption. If they're what is called chronically homeless, which has two parts, that's an exemption. To be chronically homeless, you have to be homeless for at least 1 year or more. That's the first part. And the second part is the individual has to be physically or mentally unable to work, stable to keep a job. So it's a
Okay.
two-part.
So can I ask something along with that? So with those two, with the chronically homeless
Mhm.
and mentally or physically not able to work, what are the documents that are needed? Because I'm sure you can't just take someone's word for it. So like we would have to provide a document. We have one that we use with the coalition that shows 12 months of chronic homelessness
Okay.
that I would that I upload into the coalition's database. And then we have a COC disability form that is kind of the same thing for the disability piece of it. Would
Well,
those be acceptable forms to turn in for them? Because a lot of the people because I do outreach, so a lot of the people that I am interacting with are chronically homeless and are dealing with severe mental or physical disabilities. But
if the
they
individual's
may not have actual have disability from Social Security, if
disability,
that makes
yeah.
sense.
Yeah, the most obvious is the receiving disability, but there's a lot that would be called incapacity. There's a form called a FS 704 that they can use that I was stating before that will be sent out. It's not required, but it'll be sent out, and it has to be completed by a medical professional stating that this individual is incapacitated, disabled, and um, totally will never regain work, or for a time frame, just a verification stating that the individual is unable to work. But it has to be filled out by a medical professional.
Yeah.
But also at this time, if the individual is applying in person, um, there is a worker observation that can be used if it's obvious that the individual has severe mental capacity or other factors that show that this individual would be not fit to work or unable to hold a steady job. There can be worker observation also.
Yeah, copy. The forms that we use for the HMIS database, those are HUD approved forms
Mhm.
to document chronic homelessness, and the disability portion has to be signed off by somebody who can legally make that diagnosis. So, a doctor, a nurse practitioner,
Okay.
who treats that person for that condition and can sign off that they do have that. So I would think that copies of those would be sufficient since they're accepted by HUD, which is a federal agency.
As long as it's a medical professional that is stating that, yes, that's the requirement for that.
And as of today, and there again, that those stipulations and that criteria, it seems to be ever changing.
Hmm.
I see another question about how long are they exempt if they are in a substance abuse treatment? So Copy, do you know how long or when that review process occurs?
As long as they're participating, actively participating in the treatment center. They,
So, but is there verification required by the treatment center?
uh, well, as far as the treatment center usually has a document that they send in showing that they're participating in a program
Okay.
and
So
how
as
long the
long,
program.
so there's not a time limit if they are participating because, and where I would think of with that question is while we have a lot of inpatient treatment facilities,
Mhm.
someone may also be participating in substance abuse treatment in a longer term facility because a lot of our longer term facilities will then have a step down program. They may go from inpatient to then even with housing within the community. And so is there still an exception at that time? Are they still exempt at that time? Because
Each,
I think it would probably be within the inpatient if they have the capability of working.
each time the person renews, if they state that they're still participating in a substance abuse program, they will need to provide that verification each time they renew for their benefits.
I love these questions, and I love that we are thinking about and the best way to advocate for the families and individuals that we work with. I I so often say, and I said it at the beginning of this, it should never be this difficult to receive or ask for assistance, and that's why we wanted to do this. And so I see that follow-up question about how often on the renewal. So and is that and I will ask a next question for this for copy. Is that different based upon eligibility, such as if you are in a treatment facility, is your renewal, does it come about sooner or more frequent than someone who is not? So can you speak to that?
There's 4 different certification periods. There's a 4-month renewal period, um, and that's for individuals that include the able-bodied without dependents individual. On that, let me state, if the individual is exempt work registration, they're exempt ABOD. So as if they're in or participating in a substance abuse disorder treatment facility, they wouldn't have a 4-month cert period. There'd be more of a 12-month cert period. So there's a 4-month, 12-month, 24, and 36. The 12-month is the most common. It's for individuals who do not qualify for the 4 months and also or do not qualify for the 12-month or the 24-month. The 24-month, if it is all individuals in the household, just one or all of them are elderly or disabled and don't have any earned income. And the last one is the 36-month. That's for age bond disabled. That's our ESAP program, the elderly SNAP program.
Okay. And then I see we have one more question about, as a case manager, who needs to obtain SNAP benefits letter for that recertification. Obtaining those can be a barrier. Goodness, we've talked all kinds of barriers and suggestions on how we can get those. Or is there a form we can fax in for a request for that? Do you know? And Abby, I see that you're off mute. Or that you're able to speak. I was also going to ask to clarify. Is that so that you can know that and have that in that person's kind of file so you know when their recert is, rather than there being any type of lapse or
Um,
lapse in services?
yeah, so it's a recertification for their benefits on our end. Like we have to have a benefits letter for their housing program recertification. So we really just need a statement of if they are receiving SNAP or KTAP, but sometimes getting those tends to be a little hard just because clients have barriers to actually getting to an office. For a while, we had someone at Catholic Charities who I could just send the information to, and he could get those letters. But I think that position at Catholic Charities was like defunded recently, and so after we lost Sam at Catholic Charities, finding a way to get those letters that might not be having our clients needing to go in person to request those.
So Catholic Charities specifically, we actually have a team that works with Catholic Charities specifically. So I know I said we weren't going to talk about case specifics or anything, but location specific, Catholic Charities does have a team that works very specifically with them. So that may be kind of an outlier, and that there would be that direct access. So it may be just asking whomever your contact there is to say, when does the DCBS, the family support staff, when are they here? Because we are not there all the time, but but we are there in person, actually on a very regular basis. Does that help at all?
Potentially. So like in the past, the SNAP outreach person at Catholic Charities.
Mhm.
I was just able to email him like case number or birth date, social security number, and he could send me their last proof of benefits letter. Does that, is that still like something that is available for service providers, or how does that work?
We have a proof of benefits request for information. It's a proof of benefits letter. There is one, yeah, it needs to be requested.
I
Is that
think
something
that
I
that
can like print out and have our clients sign and fax in? How does that, where would I find that?
um,
Um, it- at the DCBS office, it's a form that a worker can look up that information and put that information on the form to be sent.
but if
Gotcha.
they
I
don't
guess
know,
like we're just
if
looking
they
for a way
don't
to
already
request
have
that.
that, yes, if they don't already have that on their file copy, is there a place that then they could request that? Especially if it's a new case manager or someone new to working with that individual, is there specifically someplace they could go and request that, or if the individual doesn't know?
To request that letter of the benefit verification, because if I'm understanding it right, um, at the local office, you can call the toll-free number to have that requested for that specific case, household.
Okay, and how is that sent? Like if I call the toll-free number for benefit verification, can they provide document like can they fax documentation of that? Or is it just verbal?
Oh, it wouldn't be verbal. It's a document that can be sent. It can be mailed out, and if it's it's a participating, um, like another like a caseworker, someone that's another participating, not just a separate individual. If they have access to a fax machine, also yes, it could be faxed. Otherwise, it could be mailed out or just be picked up at the office.
Oh, okay, thank you.
And I see one more a person from Connect that used to come to our center and would help our clients apply for SNAP and Medicaid. Since that person left, we've not been able to get one. Is there something that is still done? I think they were called a connector.
Yeah.
Individuals, so various agencies have connectors, and so connectors are greatly beneficial for in so many ways and really assist in that initial application process. That is not the complete application process, I think is where we have found. And one of the things, if there is a spot that you would like to to discuss a potential partnership with a family support staff coming out, we are looking at that. We talked about Catholic Charities earlier. That really came from need to say, hey, we have this many clients. If someone could just come here once a month, how that could really be a game changer. If there are those, I can't and won't make any promises. I don't make promises I can't keep, but I will say we are open to any discussions about ways that we could be in the community and assist with that. And our family support staff have been so open to that and really to have that. But the connector is not something, and Copy may want to speak more on this. The connector, they are actually not a part of our family support
No.
staff. And I think that that's an often misunderstanding with a lot of people. They think that they are an extension of the cabinet or of our office, and they are actually not a part of our local office.
Yeah, they're a separate identity. They're not family support workers. So they're completely separate. They can assist with helping to apply, but they're not the ones that actually take the applications and process it. So they're not workers. They're not DCBS staff.
So I am happy to share. I will put my information in the chat, and I am happy to share and field any further questions that may arise. While we can't ever answer those case-specific questions, what I will do, and that's exactly why I said it that way, that I will field those and pass those along to someone who may answer those. But if there are generalized questions after this, please let me know. We will ensure that that the document that we went over today is received both in English and in Spanish, as well as the slides that just give you that direct hyperlink to to the website, but also that 1-800 number, because I think that that number would be so beneficial as a case manager to just have readily available at any time for your staff, and as well as that, save that save that hyperlink for that website on your favorites. That is my email address. Please don't hesitate to reach out to me. Please don't be offended if there are questions that we can't answer, or sometimes that information there again, that if as we are asking for flyers and things like that, that is an ever changing, but we will always have the most updated information. So if something has changed, just know we will always have the most updated information to verbally be able to share. And thank you all so much.
Thank you. Thank you very much for allowing me to speak today.
I'm very happy that you two were able to speak to us today. A lot of good information has been shared, excellent questions, excellent discussion, and now they know how to get in touch with you. If questions pop up later on, they've got a face and an email. That makes a big difference when we help our clients. So, uh, if you'll send me any of your materials, then I'll make sure that they get emailed out to everybody. And I hope you all will fill out the survey at the end. You'll get a prompt for that. Send that back because we do read those and take that information into consideration when we plan community table sessions and what topics you want to hear and things that people you want to hear from. So again, Koppy and Crystal, I've only known you a short time, but you have both proven to be invaluable to us. Thank you so much.
Thank you so
Thank you
much.
so
Have a great
much.
day, guys.
Appreciate what you do. Thank you.
Bye.